Hello, good morning, everyone. Today we'll talk about in missed periods, like missed patients. So many patients are taking coming to like a missed pill after taking OC pill. They are lost to. They're not remembering the pills. They forget to take at a particular time. They may sometimes they are missing the pills. So what to do in that case is if they present to your OPD, how you'll tell what advice you should give to their patients. I'll totally discuss 2016 Ministry of Health Family Welfare Guideline, the oral contraceptive pills, the miss pill guidelines. Okay, first is if the patient came, she will tell missed pill one or two pills. Okay, she had a lost. She has not taken one or two pills, or she had started the new pack. Usually if she has to start on the day one of mens, if she started on day 3 day 4 1 or 2 days late, then in that case what to do? Missing or late starting 1 to 2 days late, or miss 1 to 2 pills. In that case you have to advise the patients take one. She has to take that missed pill as soon as possible. Okay, the missed pill has to have a two options. Okay, in that case we have a two options. Okay, if she had patients have a two 1 or 2 pills missed, or the patient started the pack 1 or 2 days late, then you have a two options. The first option, she has to take the one hormonal pill as soon as possible, that a missed pill as soon as possible she has to take. Or the second option is that she can take two pills at scheduled time, at the next usual time. At that time she can took two pills. Here we have two options. You can see we have a two options. In the first miss one, she is to take the as soon as possible. In the second, she can take two pills in the next scheduled times. Okay, here you have to counseling the patient, that is there is little or no risk of pregnancy if you missed 1 or 2 pills, or if you start 1 to 2 days late, that is fine. Okay, no worries, you can take one pills as soon as possible, or you can take two pills at the same next usual time, scheduled time. Okay, this is the first. Done. Then the second point, if patient came with missed three or more pills, suppose he has not taken in the 1 week, three or more weeks in the remember this is the first and second week. They have divided now the missed pill based on the week. Okay, first is three or more pill missed in the first or second week. If missed three or more pill in the third week. Okay, difference you can see. Suppose in the first week, second weeks, or she started the pack 3 or more days late. Okay, initially it is 1 to 2 pills or 1 to 2 days late. The second point is miss three or more pills in the first or second week, or she can started the new pack 3 days or more late. In that case what you will do, patients if miss the pill, then they take one hormonal, very very important. Don't take the three pills at a times. If you miss three or more pills, but you have to take one hormonal pill as soon as possible, very very important. They may confuse you, right? Okay, if patient is missed three pills, she has to take the three pills at one times or one pills. So remember it is one, not three. Okay, continue, and they should continue the schedule field. Okay, this is one options. Then here what you'll do, they have to use a backup methods, very very important. Backup method for the next how many days they have to use backup method, how many days? For 7 days. Okay, so they have to use backup method for next 7 days. Then next you can, here you can consider, because the chances of pregnancy is high, can consider taking emergency contraceptive pill if how, if she had an intercourse in the past 72 hours, 3 days. Everywhere is 3 days. Okay, so what is the options for miss three or more pills in the first or second week? If she missed the three pills or more, three or more pills in the first or second, or if she started 3 days more late, then she has to take one hormonal pill. Remember, one, not three. One hormonal pill as soon as possible, and continue the schedule pill rest as advised. Then here the backup method is coming. If three or more backup methods is there, should be used for how many days? For 7 days. Then they can consider emergency contraceptive pill if they have a 3 days in between the last 3 days, if they have a sexual intercourse. Okay, then I have to use emergency contraceptive pill. Then the third options, if miss three or more pills, if miss three or more pills, okay, three or more pills, okay, if they miss three or more pills, okay, if they miss three or more pills, then what will do in the very very important here, the third week will come, third week, if they mix on third week, what you will do, okay, if they miss in the first and second weeks, three or more fields, then one hormonal pill has to be taken. Backup method has to be there. Or they can consider emergency contraceptive pill if they have a sexual intercourse in the first 3 hours, first 70 hours, 3 days. Then miss three or more field the third week. If they have a third week, then take one. Very very important. Remember one always, not the how many pills CPC is not taking. Then you have to take it the same amount. Not like that. You have to take one hormonal pill as soon as possible and finish all hormonal pills in the backpack as scheduled, then rest as soon as possible, then throw away. Very very important here, very important statement they told, because in a 28 days pack, in a 28 days OC pill pack, there will be 21 days hormonal pills and 7 days there will be a non-hormonal pill, that is the iron tablets. Okay, so here what you will do, we should not waste that 7 days time by using the non-hormonal pill in 28 pill pack. So what we'll do, without wasting the 7 days non-hormonal, without wasting the using the non-hormonal pills for another 7 days, we have to throw out the all seven non-hormonal pills. Okay, and immediately and the next day you have to start the new pack, because you have a law, you have not taken three or more fill in the last week. That is the very important chances of pregnancy, again implantation, everything will happen that times, no, so you have to very cautious. So as soon as possible one formula has to take and finish all hormonal pills in the pack as schedules. Okay, once then throw away the non 7 days non-hormonal pills in 20 days pill. Then after this over, then you start without wasting time, without wasting the 7 days non-hormonal pill. You have to immediately after 21 days everything is completed, you have to start the new pack in the next day. Same as here, you have to use the backup method for the next 7 days. Also, if you consider taking emergency contraception if she had a sex in the past 72 hours. Okay, so very very important, missed, if you missed one or two pills, started new pack 1 to 2 days late, then you have to tell the patient take one hormonal pill as soon as possible or two pills at the same schedule times. Okay, there are little no risk of pregnancy if missed pill, uh, if missed pill okay, if missed three or more fill, okay, missed three or more fills. Okay, if missed three or more fills in the first and second weeks and started new pack 3 or more day late, then take one hormonal pill as soon as possible and continue the schedule fill. You have to use the backup method for next 7 days or emergency contraceptive pill if she had intercourse in the last 3 days. If three or more in the third week, very very important, you have to take on one hormonal pill as soon as possible, finish all the tablet in the schedule pack, then throw away the non-hormonal without wasting the time, 7 days non-hormonal pill, then start, you have to new pack after 21 days of the overing of the hormonal pills. You have to use backup methods, consider the emergency content the next 7 year. Another very very important, this can be a combination net questions, missed any, if you missed any non-hormonal pills, last 7 pills in the 28 pills, if you write here any non-hormonal, because last 7 pack, the 21 plus 7, no, this non-hormonal pack, if you lost that, if you miss any non-hormonal pill, then what will do, dispose of any missed non-hormonal pill. You have to dispose the all missed dose. Suppose you have taken 3 non-hormonal pill, then 4 5 you miss, then you have to dispose all this 4 5 6 7, then continue taking your combination OC pill, one pill each day, and begin the new pack as you normally would. Okay, this is the guideline for missed pills users, those who are missing the tablets, not taking properly. In that case, thank you. Please like and subscribe. I will upload more videos and for the recent NET and NET SS and FAT, and also for face graduate and undergraduate students.